and then you just push it. Oh my gosh, it burns. Oh. Hey, what's up? Welcome back to my channel. You know, in this video, we are actually going to be giving
Saizen
and also Follistim. And we're going to show you how to draw those up. These medications are used for egg retrieval, IVF, very important medications. This is not a sponsored video whatsoever or any health related advice to you. So just remember to talk to your doctor for any advice. But hey, if you don't know who I am, my name is Sarah Chicharo, and you know, I was in a car accident 19 months ago, you know, that left me in chronic pain and also depression. And you know, so both of us, we've had to wait for this process. We didn't want to wait to do IVF, but you know, life is just not going to stop for us, and we want to continue this no matter what. And so I wanted to show, you know, some courage and some strength for those that, you know, have chronic pain or depression. You know, don't stop what you want to do. You can do something and continue with some life goals. Try to do a little bit of them. So we're gonna do our egg retrieval and, you know, take those medications. Hey, so we got the Saizen, and we're gonna be cleaning up this top right here. And this is already constituted. We actually already put this water in with this when we did the first half of it. So this is the second half because we're giving this every other day in the evening. So I know this is a really weird station. Usually you wouldn't be doing this. So I have a needle and I have a syringe. So what I'm gonna do is just pull this out. Here we go. And then of course I have this needle right there. Okay, so we have this, it's already clean. All right, so we're gonna uncap it. Gotta be careful with this needle, there's no safety on it. Just do this, and then we just draw it up. And of course, look how slow it comes out. So I'm just taking the whole thing, and that's it. So that's done. And remember, this needle's still uncapped. So I want to go all the way to the top. So it's about half. Yep, it's half exactly. All right, so this is a new needle. Here we go. Now we're gonna clean the area. So I have alcohol. So I'm gonna give it, let's do it. I kind of want to do it on this side. I'm just gonna pinch, do this, clean the area, and then uncap it. Jen's helping me with that. I have it all ready, and then we want to see a little bubble at the end. There we go. We want to add a little bit of air to it. That much will be fine because we want to make sure we get all of it in. A little bit of air, you know, at the behind will be perfect. And then, this is my least favorite part. Okay, that wasn't too bad. There we go. That was all of it, and if you see, it's all gone. That's why you put air behind it. And so if you can hand me the alcohol wipe, Jen. Sorry, I can't really move forward. I just want to cover this really quick, that way it doesn't leak out. And so remember, this is uncapped. This is very unsafe. I don't know where our jar is. In nursing, you're never supposed to cap it again. That's actually one of the laws. Never do that.
A needle already.
Yeah, where's the other cap? Where's the other cap? Oh, there it is. You never want to recap it, but we're gonna do it just this one time. That didn't feel too bad. I mean, that was 0.5 mils. You know, that went in. It felt like it stung a little bit, you know, and you saw that it was a little bit of redness around it, but not too bad. So yeah, now we're gonna do the Follistim, okay? This is a cartridge, just like that. And so what I'm gonna do is take the top. I'm gonna use this, and I'm gonna clean the top, and then we're gonna use one of these things. Oh my gosh, and I'm probably gonna give it at the same area, the same kind of site on the other side. And so if you do this has a needle as well. You wanna do this. This has a little bit. And let me just recap that just for a second. And then that's in the right spot. And then you wanna give, this one is painful, you guys. This one I do not like. It's like a 1 pain. It's not that bad, but this is some fluid that goes in. 225 right there. And so I don't like this one. This one I'm scared of, actually. The other one wasn't too bad. Okay, so we're gonna do this again. So I'll probably give it about right there. And I'm gonna hold it for 10 seconds right after as well. I wanna make sure all of it goes in. This goes in all the way straight. And then you just push it. Oh my gosh, it burns. Oh. I'm almost there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. And that's bleeding quite a bit. Okay, and then we're gonna have to take that needle off, but I need to wait for this because I rather keep the medication in, you know? My mom's gonna put the Band-Aid. Oh, it's a nice Band-Aid. It's actually very thick. So we're gonna leave that on there because it looks like I've been bleeding a little bit, which is kind of weird. I mean, it feels like it happens quite a bit with this medication. Yeah, so those are the 2 medications that, you know, we gave tonight. I wanted to talk a little bit about Saizen because this is an important one. We're taking this every other day, 0.5 mils. And this is important to keep in mind because this is a 5 milligram amount for each, you know, mixture. Do you have anything to say about this?
Saizen is used for stimulating follicles, and it's a growth hormone. It's an off-label use. This is also used for stimulating growth in adolescents. It's used in a small dosage for IVF, and it's supposed to improve egg quality. It's also very expensive.
It is very expensive. How much was this?
We have a paper around here, but it did say $1,300.
$1,300 for this medication. See?
So it surprised us with the bill.
It's a big buck right there. And so it doesn't have to be refrigerated at all. And so that's one thing that just keep in mind. But of course, this one can be a little complex to constitute because it's definitely, you have to read how to do it, okay? I would recommend talk to your pharmacy or something because I had a little trouble trying to figure out how to mix it. And, you know, I'm a nurse, and so it's like I've mixed many medications, and so this one was a little bit interesting. It's complex, but it's not complex enough. I mean, you could figure it out, but you might need pharmacy help or even talk to the nurse that, you know, supplied it or whatever. But so yeah, let's talk about Follistim. I wanted to talk about Follistim a little bit because, you know, this one has to be refrigerated, and that's a big deal because if it's not refrigerated, it won't work very well. And look, it comes in a beautiful case. That's what I liked about this one. And it's a pen looking thing. If you're diabetic and use Lantus or any insulin, it's very similar to that. So just keep in mind, it actually has the units, the IUs on it. And, you know, it could say, depending on what your doctor is prescribing you. Like for me, it was 225 for what I have to have every other day. And it's very easy to use. Yep, there she goes. You have to add a cartridge.
This is a needle. Oh, the cartridge is inside. You're right.
Yeah, you have to add it in there.
Yeah.
To set it up, and then you have to like flick it. Yeah, and separates and all that stuff. But I mean, you can watch a video on that. Talk to your pharmacy about that. But if maybe we get a chance in the future, maybe I can show you as well. But we didn't get that chance to do that because it was already in there already. So, but I know that there are future ones that we can do and put them in there. For some reason, these are the needles that come on the top of each one, and so they actually come in this container, so it's very easy to carry with you. And of course, this has to be refrigerated, so don't forget that, okay? That's like the biggest deal that even pharmacy was saying to us. These both medications are sub-Q, so you have to give it in the subcutaneous tissue, so not in the muscle, so it's in the fat tissue. Do you have anything else to say about this medication? Or
the only other thing that I could say is that you take it according to what your doctor wants you to, because it says some of them are given in intramuscular.
Yeah.
You know, some doctors prescribe it intramuscular.
Oh, I didn't know that. So they do.
Yes.
Okay.
When I was reading about it.
Interesting. So sometimes they can be given in the deltoid, like
large muscle, probably the thigh or the buttocks.
Okay, interesting. So interesting. I actually like the subcutaneous area a lot better, like the lower abdominal area. I actually don't prefer any leg injections. I'm sorry, but that freaks me out. I don't want my nerve to get caught. I know that they say sometimes if you give an injection there, like your sciatic nerve, like you can hit it accidentally. Like I don't want to have any more pain as I already have. But yeah, anything else?
That's
We've covered it.
That's it. We're excited that we get to take these.
What day are we on? 3?
Third day.
Okay, third day. Oh, sorry, I didn't mean to smack you in the face. All right, so excited. Hey, I hope you found this video valuable too. You know, sometimes it's really weird, you know, having to give these injections, but it was pretty awesome. Saizen and also Follistim. You guys need to review that again. Just be sure to rewind it. It's actually not too bad to draw it up. Do you have anything to say?
It kind of burns a little, but
you didn't feel it.
Rotating the site, that's what she tells me, that it burns.
It does burn. I'm just like, oh my gosh. But hey, if you like this video, give it a thumbs up. Also, be sure to subscribe down below. This is really important to us. Hey, be sure to check out my socials, this way we can stay connected. My DMs are always open. Alright, I'll see you in the next video. Peace.
You have to be your biggest fan. And when things are really tough and they're really rough and nothing's working, but there's something inside of you that says, I just have to follow that. Because you don't know who you're going to meet, who you're going to meet, who you're going to meet.